Oh, Jessica, happy birthday for last week. Was it one of those ones when the big hand turns over?
The big 4-0, Matthew Holt, the big 4-0.
Oh, congratulations. You look fabulous. You don't look a day over 39.
I just can't believe I've managed to take care of myself as an adult for more than 20 years now.
Wow. Well, we'll see how it goes. You've got a bit further to go before you can really screw it up properly. Look at me.
We've come pretty close a few times, but it's the March 9th episode of Health in 2.0.
So Jessica, how is birthday month going? I know you took a couple of days off. I got an email bounced from you saying that the staff of WTF Health were off celebrating the founder's birthday, which I guess was true.
all of Jessica's. We were all together.
That's
a nice party. It was great. We took 2 days off. Worked for most of them, but we tried.
Well done. Well, congratulations on that. And while you were gone, a little action. Your friends at Oscar IPO'd.
A new stock to buy.
Well, I mean, it looks like new stock to sell because it went down. They priced at the top of the range.
Don't sell anything right now.
And it went down. But a lot of stuff's down that we should be buying in, maybe. All right.
Yeah.
Oh, very good. Still, we don't think, you assume that things will be all over. The stock might have a hell of a week, but apparently not. There are some deals to be talked about.
Deals have been done. Let's do it. Get your timer, please.
All right, timer is on the way.
All right, here we go. DispatchHealth. Wow, massive $200 million series D round. This brings our total to $403 million. Matthew Holt, what do you think?
Yeah, well, this is let's send a combination of a nurse practitioner and assistant to someone's house. I think it's a very expensive way of delivering care in the house, but nonetheless, with COVID, plus with the focus of Medicare Advantage plans and Medicaid plans on the very sick, the chronically ill and urgent care in the home, you can see a lot more of this kind of home visit. I think a lot more of that would be kind of automated with lower level people and more technology, but it's a big number, and Heals in this business as well, and a bunch of others as well. So I think that there is clearly, they decided that this is where the future of care is going for a lot of people and for a lot of sick people. So see more of that to come.
All right, more of a tech-enabled health at home. TytoCare gets $50 million. Another Series D. This brings their total to $125 million. What do you think?
So TytoCare is not like this. Dispatch is a full service to send people to home and take care of you. TytoCare is like a little device.
I'm saying tech-enabled. If you want to throw more tech in it, the opposite end of the spectrum is this.
But this is for people basically this will like help people extend teledoc and docs on demand, that kind of stuff. So it's a nice move. I think the price is a bit high when they get it down below sort of $300. I think everyone in America will buy one.
Okay. How about this Highmark Google Cloud Verily OnDuo thing that happened? Explain this one to me, break it down.
So I think this is mostly about Google Cloud buying market share. They wanted to Highmark, a big health plan in Western Pennsylvania, and said, we'll do this great thing with you. They've lumped in Verily and apparently OnDuo in the Google press release. In the Highmark press release, they talked all about this living health thing that they're building, which is some kind of plan to do stuff. And what is this? Who knows? They didn't mention Verily or OnDuo, so I think this is mostly about Google Cloud buying market share, but there may be some other stuff in there.
How's Amwell fit into that mix?
Who knows?
they had a deal with Google. I mean, just interesting names swirling around that.
You spent so long talking about Amwell, we can get to the next question.
I thought it went off already. I thought I heard it. Sorry.
That's right. Well, the point,
my hearing is going in my old age now.
Yes, the geriatric session is. So, I mean, if you think about it, AWS is the clear market leader in cloud stuff, right? Microsoft is second, and Google, which has a ton of money, but it's sort of a lagging third, is trying to do whatever it can to catch up. So I think the Amwell thing is also the same. If you can move Amwell onto the cloud, if they can start building a bigger group of clients in health tech on the cloud. They also announced Google Care Studio last week, which is kind of their search tool that they did with Ascension. They had a lot of controversy last year when it was discovered they were getting identified patient data, or it was happening on Google's thing. But searching into an EMR is something that most current EMRs can't do. So hopefully that'll fix some of that. Amazon's got a somewhat similar tool in that space as well. So they're all kind of mucking about and crowding around as to what kind of services they can provide. And healthcare is, I believe, 18% of the GDP, and those big tech companies can't quite ignore it. So.
I like what you wrote in the THCB newsletter about like how healthcare delivery hasn't changed from like 2010 to 2020, but that it looks like it's going to shape up to change very much by 2030. I thought that was very insightful.
Well you can argue healthcare hasn't changed since 1950, healthcare delivery, but certainly in
Can you ever just take a compliment and not argue like why? I said that I like, you're lucky I even remembered you wrote that. Okay, first of all. Second of all, you're like nitpick with me. Like, no. You got it all wrong. You
got it right. I did say that. Thank you for noticing and taking a look. And we'll take the compliment.
Jerk.
You're welcome, jerk. Yes, absolutely. but it's all the stuff we've been talking about, moving it to the cloud and sensors and mobile and stuff, hasn't really impacted the core delivery of healthcare now. But if we're going to have things like dispatch, right, which come to your home and do stuff, and TytoCare plus telemedicine with delivering TytoCare actually takes your temperature, has a camera and it takes your heartbeat and all that kind of, you can stick it in your ear, and it enables a lot more of this remote care delivery that we've been talking about forever to actually happen. So it's still not here yet, but yes, over the coming years that will in the end change what healthcare delivery systems look like. Maybe.
I like it.
Or maybe it'll still be the same stuff for another 10 years.
My guess is that regardless, the one thing that will be happening is that you'll be arguing about it with whoever brings it up to you. And for all of that fun, follow the big guy on Twitter over at BoltyBoy. I'm over at Jess, and you can sign up to receive Matthew's little insights, whether he appreciates hearing them said back to him or not. You can still read them and enjoy them in the Healthcare Blogs weekly newsletter. It gets out on Fridays, and it includes all of the best content of the blog for the week. So my WTF Health interviews, these Health in 2.0s, and then some of the brilliant editorial articles by some of our contributors. Are you going skiing over there in your chalet?
I'm in my chalet, and I'll definitely be thinking about going skiing later. It's not a great day for it today, but hopefully a bit of snow. Maybe sneak out tomorrow. Maybe.
All right. Well, good luck.
Thank you.
Thanks for the birthday wishes. We'll see you guys soon.
You're welcome, birthday girl. Bye.
Bye.